Hello, everyone. Welcome to Health Series Podcast. Today, we're going to be looking at the topic health system of Nigeria versus that of France. Comparing the healthcare system of Nigeria and France reveals significant contrast in terms of structure, accessibility, financing, and healthcare outcomes, largely shaped by economic resources, policy frameworks, and political priorities in each country. Today, we're going to be looking at different areas, starting with the healthcare structure and access. Nigeria's healthcare system operates under a decentralized framework divided into primary, secondary, and tertiary care. Primary health care is intended to be the foundation, especially in rural areas, though this has been limited by challenges in funding, infrastructure, and staffing. The government and private sector share responsibilities, but about 60 to 70% of healthcare costs are out of pocket. Public health facilities are often under-resourced, and access to specialized care is mostly limited to urban centers. France has a highly centralized healthcare system, widely regarded as one of the best globally. The French system is based on a social insurance model, largely funded through employer and employee payroll contributions and supplemented by the government. Access to healthcare in France is universal, and individuals can see general practitioners and specialists with minimal cost due to widespread insurance coverage. Health services are generally accessible with a broad network of providers across urban and rural areas. When it comes to healthcare financing, Nigeria allocates only about 4 to 5% of its national budget to healthcare, though expenditures often fall below WHO recommendations of about 15%. Healthcare financing relies heavily on out-of-pocket expenses due to limited insurance coverage. The National Health Insurance Scheme, NHIS, covers only a small portion of the population. Consequently, financial barriers significantly limit access to healthcare, especially for low-income individuals. But in France healthcare is funded primarily through national insurance, health insurance, also known as Sécurité Sociale, with coverage extending to nearly all residents, payroll taxes, general taxes, and users' fees partially reimbursed, sustain the system. Citizens also have the option of private complementary insurance, which is also known as Mutualist, for additional services. France allocates about 11% of its GDP to healthcare, one of the highest in the world, ensuring a high standard of care with minimal out-of-pocket cost to individuals. The third part is health outcomes and quality of care. In Nigeria, health outcomes in Nigeria face challenges due to infectious diseases, maternal and child health issues, limited access to quality care. Life expectancy is around 54 years, reflecting ongoing struggles with communicable diseases like malaria and HIV/AIDS, along with growing number of communicable diseases, non-communicable disease burdens, under 5 mortality rates and maternal mortality rates are among the highest globally. France boasts high life expectancy of around 82 years and generally positive health outcomes attributed to preventive care, early detection, and effective chronic disease management. Non-communicable diseases such as cardiovascular disease and cancer are prevalent but are managed effectively. France boasts high life expectancy up to about 82 years and generally positive outcomes attributed to preventive care, early detection, and effective chronic disease management. Non-communicable diseases such as cardiovascular disease and cancer are prevalent but also managed effectively within the healthcare system. France maternal and child health indicators are among the best globally, thanks to strong preventive care measures. When it comes to human resource and infrastructure, Nigeria faces a shortage of healthcare professionals, particularly in rural areas, due to brain drain, also known as JAPA, and uneven distribution of medical workers across the country. Hospitals often lack in adequate facilities, equipment, and staff, affecting the quality and availability of services. The concentration of healthcare providers only in urban areas further worsen and widens health disparities among urban and rural populations. Whereas in France, It has adequate supply of healthcare professionals with high level of training and specialization, supported by strong infrastructure and access to medical technology. The government provides incentives to doctors to practice in underserved areas, balancing healthcare provisions across the country. Public health programs in Nigeria are underfunded and limited in reach, often struggling to address the root cause of disease spread, such as sanitation, vaccination coverage, and health education. While some progress has been made, there's still a need for more robust, widespread prevention programs. France places a strong emphasis on public health and preventive care, investing heavily in vaccination, regular screening, and health education. Preventive measures are integrated into the healthcare system, contributing to better health outcomes and disease management. In the area of policy and innovation, Nigeria's policy goals focus on improving access and reducing out-of-pocket expenses through reforms in health financing and health system strengthening initiatives. However, policy implementation faces hurdles, including inadequate funding and corruption and administrative challenges. Whereas France's healthcare policies aim to adapt to an ongoing and aging population with a focus on e-health and telemedicine innovations. The government also emphasizes improving cost efficiency and high equity with ongoing policy adjustments to ensure sustainability and access across socioeconomic groups. On the other hand, France's healthcare policies aim to adapt to an aging population with a focus on e-health and telemedicine innovations. The government also emphasizing improving cost efficiency and health equity with ongoing policy adjustment to ensure sustainability and access across socioeconomic groups. In conclusion, France's healthcare system with universal access, substantial government investments, and a focus on preventive healthcare contrasts sharply with Nigerian health system, which is marked with underfunding, reliance on out-of-pocket payments, and limited access to quality healthcare. Would appreciate if you like this video and you subscribe to this channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue to explore the world of healthcare with us.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.